Hello everybody, welcome to the next episode. Today I'm going to be going over cosmetics, the different types of cosmetics. I'm actually going to show you a couple of models and what is it that it has to do. Is it, when is it adequate? When is it beneficial? What are the, things that you have to look out for when you get them done? Because like a lot of misconceptions, some people think that sometimes when they get certain things done, then that means that they're done. They don't have to take care of it, that it's for some reason it takes care of itself and you're perfectly fine until they find out the ugly truth. So as always, I'm not a dentist. What I do have is many years of experience in the dental field, training patients, educating them, and showing treatment plans with different types of options, what they can do, what options they have, and why is it they got into the situation, what can they do to fix the situation, and what can they do to prevent the situation from occurring again in the future. So without further ado, cosmetic dentistry. So what is cosmetic dentistry? Cosmetics, as in pretty much any other anything in any other fields, has specifically to do with the look, how things, how something looks, and more of the way that you want it to look, instead of sometimes maybe what you were born with through genetics, or maybe an accident when you were younger, or you just not taking care of your teeth at younger years, and then later in the future you decided you're tired of the way you look and you want it to look better, for many reasons. So in most occasions, when it comes to cosmetic dentistry, most people really only care for the front 6 teeth on the top and the bottom. Why? Because that's the one that everybody, when you walk down the street, can mostly see. When you're eating, when you're talking, when you're smiling, for all the reasons are those teeth that most people see. So because of that, most people tend to care for those. And in the medical field, they're called as the social 6. And obviously it would be the social 12 because it would include the bottom ones. But in reality, most people actually care for the top 6, because when you smile, most times when you give a light smile, you only really see the front 6 teeth on the top. You don't really see the bottom ones unless you give it a really big smile. Then at that point, you would really, that's when you notice it. I look really silly doing that. But anyways, so I do have a couple of models here, and there's different situations for different people. There's some, which you can consider cosmetic dentistry, but they're more on not a health, but well, it could be health, but also other situations in the future that you might have not known. One of them could be, for example, here's a model of a bridge, okay, and it's obviously the front 6 teeth, like I said. So 1, 2, 3, 4, 5, and 6. It's from canine to canine, or considered the social 6. And in this situation, this model, for example, this person lost their front teeth. Okay, it could be because maybe they got it extracted. They could have gotten into an accident. They could have had periodontal disease and those teeth fell off. There's 100 different reasons for why they could have happened. And then the dentist, what they prescribed to them was to get a bridge. Okay, so why did they get these two and these two, and instead of just getting maybe a regular bridge and getting one here, and then covering it over and just getting a 4? The reason why, and this is also, you want to take this into account whenever you take care of your front teeth, when it comes to putting a crown or putting a bridge or an implant. These teeth are obviously going to look the best way that you want them to be. If you want them to be a little bigger, if you want them to be wider, if you want them to be, more natural looking, you have the choice. Unlike when you're born, you don't have the choice of how your teeth are going to look like. And then as you get older, you don't have the education, so you can lead to making mistakes, smoking cigarettes, drinking a lot of dark drinks, and wines and things like that can stain your teeth. And then you get into these situations and you want to try and make it better. And you want to find the most effective way, sometimes cost effective. Sometimes you don't really care for cost. And so when you get these, and you get, let's say, just one crown, if your other teeth, especially the front ones, don't look the same, obviously you're not going to want to get a crown that looks, that in your eyes looks ugly. You want to get a crown that looks the best, and it looks great, it looks Hollywood adequate. So what you do is that normally, if you were to get, let's say you get one front tooth, then you want to get both, because that way they would match and it's less noticeable. Ideally, you would want to get all 6, because again, these are the ones that everybody sees, and you don't want them to mismatch. You want them to you want them to all look uniform and look good, because it makes it look more natural as to your teeth. Okay, now these are ones that fit and match the person's his molars. So you can get them the regular size of your natural teeth. There are people that sometimes don't like. They say that their teeth are too small, and in the event that they think their teeth are too small, you can get your teeth when they get crowns to look a little bit bigger. So that way you feel more comfortable that way. And there are people that do that. There are people that sometimes they feel that their teeth are too big, and you can get them smaller. But when it comes to resizing them, either small or big, you have to. The dentist always make sure that the dentist makes sure that the enamel that they remove is enough where it might not cause you problems in the future where you might need to get a root canal, because that can happen. And also, if you have cavities or things like that in those other teeth, you want to take care of them, because again, you don't want that to happen. You don't want the decay to be so big where, in addition to having to take care of that area, you also have to get an additional expense to take care of that other tooth on a root canal, which again, root canals can be very expensive. So that's an example with somebody who got into, they might have had an accident where they lost those two teeth. This is more of a person that might have had either their front teeth might have fractured. Again, they don't like the size of their teeth, so on and so forth. And so this person, in this case, they have one crown here. I'm not sure where the other crown is. They might have disappeared. But this person had one crown here, and then they had a 5-unit bridge. But the 5-unit bridge has all their teeth there. So if you notice, all the teeth here are different. Some are worn down. This tooth is broken. So what we do is that we put a bridge that has actually a hole to fit all the teeth, and it replaces the teeth that you have there. So obviously some of these are healthy. The dentist, what he did was just shave them down a little bit, and then he put it on top to cover the teeth that were damaged underneath. Obviously these are cemented in, so they're stable. You never have to remove them for any reason. You do have to take care of them, just like anything else that you get. Okay, and then that's what it looks like. So if you notice, it's more adequate. Now these are the ones that you normally would want to get in the event that you might not like the way your teeth look. So that's one way, and it's also the most common form of cosmetic dentistry. Another way for cosmetic dentistry would be, and again, you can consider them that would be implants, because obviously they're putting a tooth there where there wasn't one before. If you get independent crowns in your front teeth, maybe you don't like the way one looks, but your teeth don't look bad, you can get one crown. And when it comes to cosmetic reasons, these are things that are normally not covered by the insurance, and there's normally no health reason for you to need to get one. So if there's no health reason, then your insurance company is not going to pay for it. Normally they ask for x-rays, for narratives from the dentist and stuff, and if they don't find the reason for why you would need that procedure, then they could deny the claim, and then you would just have to pay out of pocket. So that's essentially the difference between cosmetic dentistry and just like regular dentist, when you have pain, and when you get a routine checkup and you get things that the dentist recommends you to get done. Other things that are considered cosmetic dentistry, for example, and I've gone it over before, is bleaching, because bleaching is the whitening of the teeth to make your teeth look whiter. Now, when it comes to cosmetic dentistry, it is fairly important, especially when you're getting bridges or crowns and stuff, that you consider getting bleaching prior to getting any work done. The reason why is because these crowns, they don't change color. They're ceramic. There's zirconia. There's the whole different types of varieties that you can get, and they're not natural. They don't, they're just complete one color, and that's it. It's like paint on the wall. Like, the only way you can get dirty is if you put a stain on it, really. But foods are not going to stain these teeth. They're not going to stain ceramic, so that's not going to happen. So if you want whiter teeth, then you should definitely, and even if you get fillings, you should definitely consider always getting bleaching prior to getting any work done on your front teeth specifically. Because what happens is when you get the bleaching on, your teeth obviously will turn whiter. Then you get the crown, and the crown is going to match those teeth are the way they are now. Now, obviously, some people are like, oh, well, then my natural teeth are going to get darker. Yes, they can, if you don't maintain them. You can use this as a positive thing, where you remember, I have this crown. This crown is a specific color. I need to take care of my teeth and make sure that my teeth never go back to their colors they were before. So therefore, kind of forces you to change your habit. mostly through because you want to make sure that you always look good. So it's a positive thing. But if you really don't care for the bleaching, then it would be best for you to get the crown the same color as your natural teeth. But again, the only issue is that in the future, if you decide to get bleaching, then you will more than likely need to get a new crown, because that crown is not going to change color. Then you're going to get stuck with all your teeth being whiter and that one tooth sticking out like a sore thumb because it's going to be a darker color. And then the same way and vice versa. The only difference is that in vice versa, you just have to maintain your teeth. You have to keep your teeth clean, and that's it. And you can get other bleachings in the future and not have to worry about that teeth never matching again, because it's always going to match to that same whitening. So other things that involve cosmetic dentistry, some people want to consider teeth alignment cosmetic dentistry, but it's not. It's ortho work. And while it does look beautiful, it looks great at the end, which is awesome because we always want to aim for that. Your insurance company will cover it. There's a lot of benefit to aligning your teeth as opposed to just the look. The look is honestly maybe 10% of why a dentist would recommend getting ortho. Because getting ortho work is super important, and it leads to the future health of your teeth and potentially not having to worry about losing your teeth. So while most people, and I get it all the time, most people come to the office and they want to get their teeth aligned. Most of them want to do it for cosmetic purposes because they feel like it's better. Normally, when any dentist or orthodontist recommends it, they do it for the health benefits and for the longevity of your teeth. So again, it's while you may think that it is for cosmetic, it's really not. There's a lot of health benefits, and mostly for the longevity of your teeth. So another thing that is really famous in cosmetic dentistry are veneers. Veneers obviously are specifically for the front teeth. You do not get them for your molars. If you don't like the way a molar looks, then you would get a crown. Most people don't really care for their molars too much, for the simple fact that you just can't see them. So veneers, what they are, they're just instead of it being a full. So if you see here, this is a full tooth. Okay, there we go. There we go. It's a full tooth, front and back. Okay, and then the tooth would sit inside. The dentist, he has to shave the entire tooth, adjust it, and then put the crown inside. A veneer is half. So it's none of this back portion. It's literally just the front face. It's a front face of the tooth, and it has a part that sinks in to grab onto the tooth from the bottom, and then he just cements the front place of the tooth. He still has to work on the tooth, just not it's not as big, or the teeth have to be shaven down like this. It's a lot lesser, and it's mostly on the front face of the tooth. One of the issues that people have with it doesn't happen to everybody, and it is fixable, is that you get sensitivity. If you do get sensitivity, then and normally, like when you drink cold water or things that are cold naturally, you might get that pain. You might get like a shot of painness. What's happening is that because you're saving down your enamel, sometimes the cold and stuff might seep in through that weakened enamel, and it'll touch your nerves, and then you'll feel that sensitivity. So what you want to do is that you want to make sure that you brush your teeth with any toothpaste that handles enamel sensitivity. Back in the day, it used to be just Sensodyne, but nowadays there's Colgate, Crest. Pretty much every toothpaste company now has some form of toothpaste that handles sensitivity, which all it does is that it helps strengthen the enamel in your tooth, and that'll reduce the amount of sensitivity that you have. It should not take that long once you start doing that. Sometimes the sensitivity just goes away, because your nerves just desensitize themselves to the sensitivity and the coldness so much that it just doesn't bother you anymore. And it shouldn't really bother you for a long time. How long is very dependent on the individual. Sometimes a week, sometimes a month. It could be 3 months. It could be 6 months. But it shouldn't take longer than that. And 6 months is really like a really long. It's very rare cases, but it does happen because everybody's different. So in those situations, then at that point, you might want to go back to your dentist and make sure that pay attention. When is it that you feel that sensitivity? If it's because of heat and cold, then odds are that you probably need a root canal. they should have normally caught that before you got that done. But things happen and people make mistakes, and you know, not an oversights happen. It's not uncommon for any profession. But it normally doesn't happen. But if you do feel sensitivity not only to the cold but also to the heat, then odds are you probably might need a root canal. Then you should go back to your dentist and get that checked. If it's just cold specifically, including air. So if it's cold in your area and you breathe in that cold air, then you can get sensitivity from that. So it might feel like it's all the time, but it might not be. So you have to pay attention to when that can happen. So that's pretty much it in terms of that I can think of right now off the top of my head. These things are not scripted. I pretty much go through them just like how I talk to most of my patients. The doctor tells me what it is that they have, and I go and tell people what it is that they have and how they fix it. I don't like using scripts. I kind of like going from my. I feel like it's more personalized when I do it from my heart. So a lot of my stuttering and things like that is it's not because I'm ill prepared. It's just because I like talking from my heart. So sometimes people ask me something and they'll ask me the same question the next day, and I'll answer it completely different and still give the same answer, and it'll be adequate to the thing, but it won't be the same. It won't be a robotic answer, and it's just because that's just like how I like to talk. So the next thing that I'm going to be going over in the coming episodes are going to be more in depth on prosthetic things, so crowns, partials, veneer. Although I went over veneers, but crowns, partials, dentures, and things like that. And then I'm also going to go over various other things. I do have a lot of other things in the vines on what I'm going to be doing for this year. So as always, flourish and prosper, and have a good day.